Welcome back to our virtual cafe summer series. Hi, Caitlin. Welcome aboard.
Yes, thank you. I'm excited to be able to chat with you today.
So excited. We're going to say quick little coffee cheers. Cheers.
Cheers.
Drinking all the tea.
Mhm.
Can't cheers and not drink. Welcome back to those who are joining us for our summer series. So I'm very excited to be joined today by Caitlin Scott, one of the Pole Physio physiotherapists, who has been with the Pole Physio team for at least a year now, potentially longer. I'm not sure.
It all seems a bit of a blur. Throw COVID in the mix and we're not really sure what year it is.
I was about to say, it's all gone so quick. So Caitlin and I will be chatting and coffeeing and all the things, but mostly be chatting about the thoracic spine today, so the upper back area. So let's just get straight into it. Caitlin, chat to me about why you wanted to talk about the thoracic spine with everyone.
I really love how much we actually use the thoracic spine with our activities at pole, our off the pole conditioning, without actually realizing it. It's almost like it's the forgotten part of the body. We talk about the shoulders, we talk about the importance of having good shoulder mobility and good strength. We're really good at stretching for our splits because we want those really nice lines, but we often forget how important the thoracic spine is for different elements that we actually do at pole. So it was sort of an area I went, right, let's actually have a bit of a conversation about it and improve a bit of an understanding on what the thoracic spine's role and function is, why it is actually really, really different to our lower back, why it's different to our neck, and how it's got a really important part to play in what we do at pole.
Yeah. Look, I know we shouldn't have favorite parts of the body, but if we take the shoulder out of my favorite part, if we focus just on the spine, I would say that the thoracic would have to be one of my favorites because there's so much it can do and it has such a central role because of its proximity to the shoulder and to the neck. There's so much involvement with those different areas of the body that it's a real key point. Why don't you chat to us a little bit more about the anatomy, because I think, yeah, it's a very cool area of the body.
It really is. And you have got your spine there that you could probably pull up and show us. That way we've got something a little bit visual. So our thoracic spine is made up of 12 vertebrae, and they're quite unique compared to our neck and our lower back. So if you actually have a look side on with the thoracic spine, you can see, if Sim, you can just demonstrate the cervical spine, so our neck vertebrae. They're a little bit of a different shape. You can see how the spinous, what we call the spinous processes, or the part that you can actually feel when you palpate through your neck. It's a very different shape as compared to when you come down to the thoracic spine. So the thoracic spine is actually a little bit more sloped. And then if we come down to the lower back, or our lumbar spine, it's a little bit different again. You can see how wide the space is through there. And that really leads into what the role and function of the thoracic spine is. So another really key important part of the thoracic spine is where the ribs articulate. So our ribs come around in a cage-like formation, and they actually attach to the thoracic spine, which means when we're doing different type of breathing exercises, you're actually getting movement at the thoracic spine because of the rib movement too. So it creates this cage-like formation. We've got our sternum at the front of the chest as well. That sort of makes that cage through there. And it's really quite amazing how our thoracic spine moves. So the main role of the thoracic spine, which surprises a lot of people, is actually rotation. So we don't get a lot of rotation from our lumbar spine. And when we actually move through our neck, there's actually been some evidence come out that shows you actually get a rotational movement through the thoracic spine as well. So it's really, really key that we keep this spine moving, part of our spine moving well. But it's not just, oh, I'll just get in there and I'll just do a quick rotation and that'll get everything moving again. What's really, really important is that we get really nice movement first in what we call the flexion extension pattern. So bending forwards and opening up through there. And this is where the thoracic spine is so unique compared to our cervical and our lumbar spine, or our neck and our back, because we can get a fair bit of flexion through our thoracic spine. But when it comes to extension, as Simone's about to demonstrate, because of the shape of those spinous processes, you actually don't get too much extension through there. However, you need to have some extension in order to have good rotation, because if you're in this flex position, you don't actually get a lot of rotation because of the cage-like formation that the ribs form. So it's really, it absolutely fascinates me that it's not just, we're not just looking at one particular vertebrae and going, okay, this is how it moves. You've got to have a look at everything as a whole. So it's, yeah, it's really quite amazing when you have a look at the structure from that aspect of it. You've got a number of different muscles that attach around the thoracic spine as well, but it's really hard to talk about them in isolation because they're not just attached to the thoracic spine. They've either got attachments into our neck, they've got attachments into our shoulder as well. So we won't go into too much depth about that today because that's a whole other area we can get into. But muscles that you often hear people talking about, like the lats and the rhomboids, do have attachment points into the thoracic spine. So you'll often hear people go, oh, but I've just strained my rhomboids and I've just strained my lats. And we'll talk about that a little bit later, but sometimes it's not just actually the muscle that has sustained an injury as well.
Yeah. So as a quick recap then, and just because I think that straight away you've just probably blown a few people's minds. So which is always great. So the spinous processes and the neck, so the space between them, we can see that there's some decent amount of space, which means that the neck actually has a fair bit of extension backwards versus the thoracic spine we looked at here. There's quite an angle or a slope on those spinous processes, which means that our extension is going to naturally be less because we're going to be limited by a bony block through the thoracic. Versus the lower back is really designed for extending because they've got shorter, less angled spinous processes and a lot more space between them, meaning we can get a lot more extension. So if we were to bend little Mr. Skelly, we would have bent him in half, or her, non-gendered skeleton. If we were to do that, you can see that. Oh, I might have dislocated my spine. 1 second.
Which is really important. The spine is such a stable structure. It is really, really, really stable with it. So as much as we're having a great time trying to move this,
as much as I'm doing this,
there's so many other parts that come into play that it's spinal dislocations are few and far between outside of trauma.
I don't think I've ever seen a spinal dislocation. So I was going to say, most of the actual extension I've now got in it is actually coming from, and I haven't really extended it to its complete capacity, most of it is actually extending through that lower back there, and the upper back, you can see it's quite relatively flat, and then it gets some extension. So we do get some extension through our upper back, but it's only like a couple of degrees per segment. I think it's like 5 degrees or so per actual thoracic vertebra.
The research is saying it's only about 20 to 25 degrees in total max.
Yeah, that's exactly right. So that 20 to 25 degrees of extension we need to be able to utilize that so that we can rotate, because I'm not going to use Skelly anymore because I'm going to continue to duplicate his spine. So what you're saying is that when we go to flex, that really is the rib cage is a real limiting factor in terms of rotation there, versus if we're upright, we can actually access a lot more rotation. So we're naturally going to feel a little bit more comfortable into a bit of extension and rotation. Yeah.
There's many different, if you have a look at a lot of the tricks at Pole, a lot of them are an extension rotation.
Yes.
There is very, very few that, or I can't, and maybe it's my experience, I can't actually think of any that are a flexion rotation trick.
There's a couple, there's not many, and they're definitely the more advanced moves. It's certainly going to see a lot more extension rotation moves in the, not beginner, but like intermediate, low advanced and medium sort of advanced. As you're getting to more the high advanced and elite moves, we're certainly looking at a little bit more flexion rotation. But again, there are and few between, like you're not getting many of them, that's for sure. Yeah.
I think one important part to add into there as well is just about how the shoulder comes into play with the thoracic spine too. So when we do lift our arm up above our head, we've spoken about in depth with our workshops, and we're always emphasizing the importance of shoulder mobility, and that's where the upper back really comes into play as well. Often some people, their limitation can be associated with being a little bit more flexed and not getting that little bit of extension rotation, because when we lift our arm up, we actually get an element of extension through the upper back, but we actually get movement through the ribs. Yep.
Yeah. So without being able to utilize some back extension, I'm not really getting that full range of motion. So it's very subtle. It shouldn't be like a full displacement going forward of the rib cage, but we do need that opening up of the rib cage to allow that full shoulder mobility. Yeah, that's a really important point.
And it's, you know, where the role of what we do have a look at the Pole Physio and assessments is, we're not just looking at your shoulder, we're having a look at everything as a whole, because it all comes into play, even with the basic of moves as well.
Yeah. Every time I treat a shoulder, I need to be looking at the thoracic spine and the cervical spine and the rib cage and what's happening around that area, because they definitely do all play in. And sometimes even I need to look at the lower back and the hips and see what's going on there, because it really is a whole spinal situation when it comes to addressing someone's shoulder or upper back, that's for sure. Can we talk about the rib cage a little bit more for a second?
Yeah.
I think the rib cage is one of the most fascinating things in our body, because if you think about it, nowhere else do we have bone that was created in the same fashion as our rib cage. It's designed, it's there for a very specific function, and it's quite impressive that however our bodies were made, or whether it was like slightly different from caveman days and it's morphed over time, I don't know, but it's there to play a really important role. Did you want to chat more about maybe what the rib cage does from that perspective?
So the primary role of the rib cage is actually to protect all our vital organs.
Yeah.
So if we have a look at our heart and our lungs, they're all protected within the rib cage there. So that's its primary role. Without our rib cage, I don't know how we'd be able to function without our rib cage, really.
Yeah. And we have vital organs elsewhere.
We do.
Other one would be the brain, which is close by the skull. So that's probably the next closest thing that you have in terms of bony protection from a vital organ perspective. But if you look at places like the abdominal area, they're important. The organs in there are pretty important, but in terms of like immediate life or death situation.
And that's the key deciding factor, is that the organs that are required for our daily living, when you have a think about it from that aspect, our brain, our heart and our lungs. People can function without a kidney. People can function without a liver. You can function without your reproductive organs. You can function without most of your stomach. If you don't have lungs or a heart or your brain, we're kind of missing some of those key components living through that. Yeah. And it's also got a really important part when it comes to breathing. So our diaphragm attaches essentially underneath our rib cage, and the change in intra-abdominal pressure and intrathoracic pressure is actually a key component, which what helps us with our breathing. So that then adds another layer onto it that we'll talk about a little bit later, about how, well, when we do try to hold our breath, what does that actually mean for how we're actually moving through our thoracic spine and our rib cage as well?
Yeah, I know there'll be a few people who will have questions about that one, that's for sure. Yep. So I think the gist of the anatomy of the thoracic spine is that we actually have the rib cage there. We have certain anatomy to allow for key different movements, and it's all designed in a way to provide a lot of trunk stability, a lot of core stability. So the thoracic spine plays a major role in that. And then as a result, there may be some mobility restrictions due to just natural bony anatomy that our body is wonderful at making up in different parts of the spine, like the neck and lower back. So whatever we lack for in extension through upper back, we quite often make up for in different areas, which we're going to chat about later anyway.
Very true. And I think it's just important to note that there are some conditions which mean some people may not move very well through their thoracic spine. And it is something we can see in polars. So scoliosis will have, and again, we won't go into depth about it. And if anyone is concerned, book an appointment with the Pole Physio, because that's something we can have a look at and assess. If there are changes from a scoliosis perspective, you will move a little bit differently. It doesn't mean you can't do pole. You absolutely can. It just means there may be some things that need to be slightly modified based on your movement patterns. Same with things like ankylosing spondylosis. You're going to have changes with that you may not be able to modify.
Yeah.
And as long as you know about it, it's not a problem at all. So there are, as much as we talk about this and we're promoting the mobility and the strengthening, there are some people that just may not be able to get it. And that's okay.
Yeah. And I'm going to briefly touch on the scoliosis for a little bit more. It's I know we're not going to go into it too much, but there'll be a lot of people out there who have been told they've got a scoliosis. Certain amount of scoliosis is completely normal. I think it's about 35-degree angle of scoliosis that's considered abnormal. So it's a fair amount of an angle that you need that's considered abnormal before any sort of intervention from a non-conservative point of view needs to be looked at appropriately. But for anyone out there who may have had any surgery related to scoliosis, so the more severe cases out there, just so you know, it's not surgery is not a death sentence when it comes to scoliosis. I have actually treated many Apola who have had surgery through the thoracic spine, like a spinal fusion or so forth. And the idea behind a spinal fusion is so that you don't actually have the same amount of movement through it. And certainly have Apolas who, one particular one I'm thinking about, who has a spinal fusion, is able to do a spatchcock. And she is a very elite level pole dancer. So there's lots of different injuries and issues associated with the thoracic spine. But sorry, might need my coffee. I was going to say, utilizing your function around the thoracic spine, so making the most of it with a dedicated team that can teach you how to unlock the movement and strengthen around that area is really critical, or crucial, I should say, for improving the movement for pole related tricks. So if you're someone out there who has limited mobility because of an injury, regardless of whatever it is, working with a dedicated healthcare professional that understands pole and understands your body is going to be crucial for you progressing. Yeah.
And you touched on a really important point. It's not just about getting the range of movement, and it's something you'll see through our series, through our blogs. It's you can gain the movement. It's about strengthening. It's about building the proprioceptive awareness in that movement pattern so that you can then maintain that range of movement. Because, and as spinal, we see it quite regularly, is that someone will reduce mobility in a spinal area because they don't actually have the strength to control it. It's a normal body protective mechanism going, I don't feel safe there. I'm not going to let you move into that position. So it comes into the off the pole conditioning that's not just about mobility, it's about strengthening. And that's a really key part, that if anyone is seeing a health professional for an injury, for something related to the shoulder or the thoracic spine, make sure that you're getting all the exercises that you should be getting, not just here's some mobility exercises, unless you're already doing the strengthening component to maintain those mobility exercises. So it's working. It's quite a complex in that manner, but really, really exciting. There's so many different things as a physio we think about, but it's really important that we can show you some mobility exercises to do, but everyone's going to be a little bit different with what they actually need to be doing going forwards to maintain that.
Nice. I was going to say, I chatted about this with Danny as well in one of our series, and we talk about strengthening in a neutral position first, and quite often healthcare professionals are good at providing exercises in neutral positions, but when it comes to the demands of pole, we quite often find ourselves in non-neutral positions or non-normal positions that the average population wouldn't often find themselves in, like contorted positions or flexible positions. And so working towards outer ranges of strength or outer ranges just in general, and then building the strength on that is going to be quite key for pole dancers and aerialists out there. We think about something like your Allegra, which requires a lot of extension rotation. If you're not strengthening into that position, then you're not going to be able to actively wrap yourself around the pole. Or even something like your aerials shoulder mount from a Superman position, where you have to go into extension rotation. So there's a lot that our body needs to be strong enough to do to be able to achieve the position. So yes, mobility is wonderful, but strengthening is quite key, and is yeah, a lot of healthcare professionals will give a good foundation of exercises, but they don't necessarily understand the demands of the tricks that you need to do and then take it to the next level. So just be really mindful. I think what you said, Caitlin, was such a good point, was just be really mindful that your healthcare professional, if you're not seeing one of the Pole Physio team, just make sure that they are providing you everything that you need. So it's about you being very cluey about what you might be missing out on. Yeah.
And also, I think, don't be afraid to ask.
Yeah.
You know, it's every healthcare professional is never going to get upset if you turn around and go, you know, I've been having a look into this. Should I be doing some strength work? Should I be doing some mobility work? Your health professional is always I should emphasize the should, be able to answer that question comfortably and be able to provide you with exercises if you feel like you're not getting them, or be able to explain why you might not be suitable for those exercises yet, or where in the training program that will then come into play. Because as healthcare professionals, we're always a couple of steps ahead working towards your goals.
Yeah. And if your healthcare professional can't do that, then you're seeing the wrong person.
That's actually a really, really important point. I've had a chat with a couple of patients this past week about, it's okay if you've been seeing someone and you go to see someone else and you feel like it may be you have a better rapport, they've got a little bit more experience, it may just be a different way that they're doing things, a different way that they're saying things that resonates. That is okay. To then go, you know what, I'd like to explore a different physio, I'd like to go down a different sort of training pathway. Everyone's a little bit different, and you can't expect that every single health care professional that you see at that point in time is going to be right for you at that moment in time. So I'm fully supportive of patients who go, oh, I've already been seeing someone else before. That's completely okay. What have they been working with for you? What have you found is good, bad? But we're going very off topic there.
So going off topic, I'm going to add one more thing on that. It depends on the therapist's skill set effectively. So that's really important, and that's where when therapists, we definitely have gone off topic, but when therapists graduate from uni, they're given a very small skill set, and they don't really understand a lot about advanced strengthening or movement patterns. They're given the real bare minimums, which is great for a certain amount of issues, and they can treat them usually quite well. But then when something more complex comes in, or when they've rehabbed that person to a certain point, they can often feel a little bit left, like they don't know what to do next. And then that's the point where, as from a patient perspective, you may then be almost pain-free or completely pain-free or almost there with your rehab, and it's just like you're not getting any further. That's when it's time for hopefully that healthcare professional to go, okay, I've kind of reached my limit, let's collaborate or utilize another therapist to help me with that. And that's what we do a lot of at the Pole Physio team, is that we have seen a lot of patients who have started with another healthcare professional and they've gotten to a certain point, which is wonderful, but then they're not making any more progress. And that's where our team has that advanced strengthening knowledge and mobility knowledge that then relates to pole itself, that can then pick up where that person's left off from. All right, let's bring it back to topic.
Some really fun myths.
Yeah, let's bust some fun myths. I love that. So talk to me about what are some myths that you get about the thoracic spine.
A great one that it's really common, I touched on a little bit earlier, is I've just pulled a muscle.
Oh yeah, I get that all the time.
I've just strained my lats, I've just strained my rhomboids. So and again, physios, we're always looking a little bit larger than just one particular area. So more often than not, when someone is saying, you know, oh, I just did this rotational movement, or I did something really quickly and I've just pulled through my rhomboids, more often than not, the rhomboids have spasmed as a protective mechanism. You've actually done a joint sprain. So similar to how we might roll our ankle and we feel like all the muscles around the ankle get really, really tight, our perineals get tight, you've actually done a sprain to the joint. So that's a really important part to play, that if I do have someone coming in going, I've seen someone previously and they've just told me I've strained my lats, or I was talking to someone at the studio or my PT and they just said it's just a lat strain, it's fine, just work through it. It's really, really important that you have an understanding, is it associated with the muscle, is it associated with the joint, or is it associated with both? Because the rehab is very, very different depending on what it is. Because if it is a primary muscle strain, That's a different pathway of rehab compared to a joint sprain. There are elements that interact, but it's really important to understand what is the actual structure that's involved.
Yeah. And the other one I get a fair bit of is intercostal muscle
Yes.
strain, which is, I kind of feel like the intercostals have become a little bit of a scapegoat, because a lot of the time this injury that you're talking about is associated with a difficulty breathing. So it's like a certain amount of healthcare professionals, I don't know why, but they get told that, you know, well, maybe the person, even they've Googled it and they go, okay, well, I'm having trouble breathing. So, and it feels like it's right here, which is between my ribs. So it must be my intercostals.
Yeah.
What are your thoughts on that?
So and I think it's something that has come from exactly what you said. You palpate the area, it's in between the joints. Oh yeah, that's where I'm sore. Well, not where you always feel pain is actually the reason why you're in pain with it. So again, we spoke about the role and function of the thoracic spine and how we've got the cage-like formation and the ribs and its role and function within breathing with the diaphragm as well. So the primary way, or the main reason people strain their intercostals, is actually from excessive coughing. So COVID, it's been fabulous. Those people that got the glorious 100-day cough afterwards, that's when you're most likely to strain your intercostals, because you've got a change in the pressure, what we call the intrathoracic pressure, which is going to put strain on your where the joints articulate. It's going to put additional strain on the ribs and then the intercostals in between it with it. So more often than not, that intercostal strain that people refer to is actually a joint sprain where the ribs articulate with the thoracic spine, and where you get the referral coming round and the changes with deep breathing. Because when we take a deep breath in, you're going to get movement through where the ribs articulate with the thoracic spine. So a healthcare professional, when they're assessing someone, will assess deep breathing to see what's that movement pattern like. Because often if that movement pattern is restricted, we've got something that's not moving properly, and it's about identifying why through there. So it's a really, really interesting one as well. And it comes into play as well about the role of breath holding and bracing, which is another fabulous myth.
I was just saying, leave that one for a sec. I'm going to talk for a moment about what you just said before, because I just want to make sure that everyone understands from an anatomy perspective, if that's okay.
Yes.
So if we're talking about the joint sprain, we're talking about back where the rib inserts to the spine, and there's actually a nerve, or every rib has a nerve that's associated with it, the intercostal nerve, that runs around towards the front of the rib cage. So people who are experiencing pain at the front of their rib cage, even, it can be coming all the way from the back, and only the back. It's got, and people go, oh, I think I've got costochondritis, or I've got something else that's going on. It's nothing like that. It's usually a lot of referred pain from that particular joint at the back. But that's why we can get pain right into our intercostal muscles on the side, and it's still not the intercostal muscles. It can be coming from the joint. And what you said before also about the coughing, that overuse or that over coughing, particularly from sickness, is more often than not the intercostal muscle going in into either spasm or experiencing an injury, but that itself can also still injure the costovertebral joint. So I just want to make sure that people are aware that you can still have joint and muscle injury, but yeah, quite often the intercostal is a lot of the time the scapegoat for any rib joint injuries that we see. So I just wanted to make sure that was all.
Well, my is fine, so you can show it.
yeah, well, good. All right, so talk to me about then breathing. So you're just chatting about this breathing and bracing, breath holding when we pole. Talk about that.
I think it's really important when we talk about breathing and breath holding, especially from a pole perspective, to have a look at beginners compared to our intermediate and advanced students. So you would expect with someone who's just first starting at pole, whether they're learning a climb, even something as simple as a climb, learning how to, even though you've got your legs on the pole, you've got some thigh grip, actually learning how to pull yourself up a little bit. When we come into inverts, you would expect that a beginner will hold their breath. You will expect that they will brace and lock everything in, because they are learning a new skill. And that breath holding and that bracing actually creates the feeling of increased stability. So it helps with that skill acquisition when you're first learning a trick. It's okay in those first stages, because it helps you, give you that confidence that, I can do that trick. I can invert. I can do a pole sit. The challenge that then comes from there is then when it becomes a long-term pattern of behavior, because it's actually promoting rigidity through the thoracic spine and rigidity through where our ribs articulate with the thoracic spine. And when we're progressing through pole, we actually need to be able to quite comfortably move through our ranges going into different tricks with it. So it's really, really important that we're aware that it's okay in the beginning to do it, but then learning how to do the trick as you build increased awareness of what your body's doing, and also increasing the strength of what's required, whether it be the shoulder, whether it be through your core, whether it be through your hip flexors. Again, it's a lot bigger than just one particular area, but that's the bigger picture that we look at with it going, in the beginning, it's okay. Advanced students probably shouldn't be holding their breath doing an invert.
I mean, perhaps when they're learning a trick for the first time, they might find themselves holding the breath, but when they're certainly doing an invert now, they should not be breath holding by then. But so the key thing to understand there is that breath holding does increase that sense of rigidity through the thoracic spine and intra-abdominal pressure, which gives you a false sense of security and strength through the core region, because you're bracing effectively. It's kind of like me saying, make your abs rock hard right now and you feel strong, but you're not actually that strong. The strength that you have is not doing anything. But it creates that false sense of security, which can be helpful when first learning, but then it actually can be an issue if we continue to do that in the longer term. So once you've acquired the skill and you feel comfortable in terms of going, okay, for an invert, I need to pull this, I need to do X, Y, and Z. Once you've got that down pat, what you're saying is that the next step is to unlearn the bracing. So if you can breathe. Breathe. If you can learn it from the start, breathing without bracing, that would be ideal. That would be the perfect scenario. But there's a lot of people who really do struggle with that. There's obviously an exception to everything. And there's certainly a population out there who, if they were to brace, it could actually be quite an issue. And that's those with pelvic floor issues, which we won't go too much into depth today, but they should be seeing a healthcare professional who's teaching them how to address bracing strategies and actually use their core correctly and so forth.
And I think linking into that, it is important that if someone is using that strategy and they are reporting that they're getting increased pain in different areas, or if they've got known pelvic floor issues, they go, oh, that. And people who have pelvic floor issues are very aware of what can happen. Let your instructor know.
Yes.
And also seek the advice of a healthcare professional, because the instructor may be able to go, okay, as much as you really want to invert, because you're bracing, we're going to take it a couple of steps back and let's try it a different way to start.
Yeah, exactly.
Nothing wrong with that at all. In fact, it's encouraged, because the instructors have the awareness and the knowledge of going, you're bracing. Most people, that's completely okay with. For you, if you're getting these sort of symptoms, let's actually change something for you in this class until you get a better understanding of what you can and can't do.
Yeah, absolutely. And I mean, we could totally go into a whole bunch of different issues here, like incontinence and prolapse and
Julia discussion, I feel.
I'll leave that to Julia one day. Yeah, absolutely. So anyone who's experiencing pelvic floor issues, this is definitely one to be seeing your women's health physiotherapist about, and certainly not be inverting or performing any movements that cause any of those symptoms, and avoiding any movements that cause bracing, that's for sure. But for anyone who's not symptomatic, bracing might be okay initially in the start, but we want to, as quickly as we can, learn how to breathe through our movements. And look, if you're lacking oxygen when you're up on the pole, there can be some other detrimental effects there. So we won't go into those either, but we don't.
That's another discussion.
Yeah, that's another discussion. We definitely don't want to be dizzy or lightheaded whilst upside down. So holding your breath can have some other issues. Also, it means lack of oxygen to your muscles as well, which means then your muscles are going to really lack strength when it comes to actually doing your next movement. So there's a whole range of issues that can happen there.
Opens up a can of worms. And I think it's also important then to, I know a lot of people will go, well, hang on, weightlifters. If anyone who's done any Olympic lifting style training or heavier weights training are taught to hold their breath and often use an external brace to help them improve their stability, because we know an external brace will improve in intra-abdominal control, or that abdominal control, and a bit of a bracing strategy. But it's important to remember that they are doing an ongoing overload. They are pushing in a particular, and it generally tends to be one particular movement pattern with it. So if you have a look at a deadlift, it's in one plane of movement. They're not going through multiple planes of movements. Even when we go into a couple of the different Olympic lifts, it tends to be generally in one plane of movement. There are, again, exceptions to the rule. So a bracing strategy for them is effective, because as they have improvements and they're pushing their PBs higher and higher, the initial weights that they were starting with, they would actually be able to do without a brace. But that's how they do their progressive overloading.
In terms of a brace, we're talking about like an Olympic lifting belt or something, for anyone who's an Olympic lifter out there. So there's definitely different exceptions and rules. It's not a hard and fast rule, but there's definitely different people require different strategies, and the general rule of thumb is breathing is preferred for pole dancers, but for other sports there are definitely going to be exceptions, and it's an overload strategy, and you're working with your therapist to ensure that there's no pelvic floor issues. And when you're lifting 200 kilos above your head, you're going to have a pretty strong pelvic floor. So that, we hope so. Some of them don't, and they work with their therapists on it. But yeah, if you've got a keen eye and you like weightlifting, you can certainly watch it at the Olympics, and you might see some issues happen for those who don't have pelvic floor, a strong pelvic floor. But we'll leave that one for another day. There's definitely a lot of videos about that, so we won't. I think there's probably one other myth that I'd like to touch on, if that's okay. And it would be about the thoracic mobility, which we've chatted about earlier. So there's a lot of people out there who feel like their upper back just doesn't move. So they don't have any medical conditions or like ailments or physical injuries to their upper back. They just don't feel like, no matter how much work they do from a flexibility training perspective or mobility training perspective, they just don't get any further movement. And we spoke a little bit about combined movements before, that we need a little bit of extension to allow rotation, and that our upper back isn't actually designed to move into extension much. Anything that I know I just sort of chatted a lot about that then, but anything you want to say to those people who feel like they're stuck?
If you feel like you're stuck, again, it's really, really important to getting assessed to make sure that what you're doing is the right exercises that you need to be doing for you. So we mentioned about mobility and the importance of strengthening. So you may actually have the mobility, but you're not doing the correct strengthening with it. And that's where getting an appointment with the Pole Physio through we've now got three people available to do online assessments. They're going to be able to tailor it specifically for you. So you can have a look at what we've done with the blogs that we've done most recently, the ballerina series. There are some great thoracic mobility exercises there, but you may not actually be doing it correctly, or it may not be the right exercise that you specifically need, or there may be a different way that you need to be doing it. So that's where working with a healthcare professional can actually help build and address why are you feeling restricted through there. And it may actually be nothing to do with your upper back too. You may actually be moving really, really well through there, but you may actually be limited in your neck.
So I think you've got some mobility exercises we'll jump straight into.
I do. I want to show my two favorite mobility exercises for the thoracic spine. And they're not something that everyone gets straight away, because it really depends on what I'm rehabbing. I absolutely love this one that Mish is showing us in a quarter kneel positioning, just putting the yoga block with the leg that's up in front up against the wall. And I like it because you're moving in both planes of movement. So you're getting an extension movement, you're getting rotation, but you're also getting rotation in both directions. So a really important part when we are doing our exercises, similar to when we're doing our strengthening, similar when we're doing our split stretching, you want to do it on both sides. And this is where this is an absolutely brilliant exercise for that.
And I like this exercise because you can hold it there. So whilst Mishka is moving through the range of motion, you can actually take it into full rotation to the wall. If you can't get to the wall, that's fine, but you can take it as far as you can go, big breath in, come out of that movement a little bit more, breathe out and take it a little bit further, and just work on like a contract, relax almost, or a breathe in, relax, PNF sort of style stretching. And your breathing out will help facilitate more mobility through the thoracic spine on every movement. And I also like this here, the pushing of the hand into the wall, so then that allows for passive stretch as well, so you can actually work on your passive mobility through the thoracic spine.
And you're also getting an element of strength.
Yes, absolutely.
You're getting a push into it. And again, like you said, with the breathing, hopefully by now everyone's got the picture that breathing is really, really important with regards to our thoracic spine. But that deep breathing, you're going to get movement where the ribs articulate with the thoracic spine. And that's why people go, oh, if I just take a really deep breath in and out, I seem to be able to move easier.
Yes. And that will make you feel so much more comfortable in positions like your ballerina, your Gilegra, etc., all your rotational movements. And you'll be able to go, oh, I can actually hold this position and feel like I can breathe now. And that's important. So key things to note here is this is the outside leg in front. If you put the inside leg in front, it's not going to work. And so then the yoga block has to be against the wall. And it's basically horizontal length. That's important. You can't do it this way, otherwise it will just fall down. The idea behind the yoga block is so it locks the pelvis and it isolates as much as possible the movement to the thoracic spine. Yeah,
I think an important part is there as well is make sure you move your neck. So your head should follow your hands. Yes. Otherwise, you're going to find that you feel pulling in your neck and straining into your neck.
Yes, I like to cue off and look at your elbow.
Elbow. Yep.
Yeah, that's a nice one for this one. All right, that's the kneeling wall rotation. Let's bring you back to our coffee shop, and we'll bring up the next variation or next exercise that you wanted to share with everyone. So I think you're demonstrating this one.
Yes, I am demonstrating this one. This is it's often called a scorpion exercise, but I really, really like it from a thoracic mobility exercise because it's starting to move a couple of things at the same time. So whilst you're creating a nice stable point from your upper body as compared to the lower body with what Mishka demonstrated, you're able to get that nice thoracic extension rotation, and you're actually able to push away. You've got a nice long pec stretch with your hand that's flat on the ground, and then the other hand that's up near your face can actually push away and get a little bit more of that extension rotation movement too. And the best thing is you get to lie down, which I
love that.
Especially at the end of a class.
Yes, absolutely. This is a nice end of the class exercise, that's for sure. What I really like about this one, like you said, is it's a combined spinal movement. So it's not keeping the pelvis still, it's now utilizing the whole lower back thoracic complex, and it's a really nice pec stretch. It feels really good. You might even notice that you crack with this one in terms of self-manipulate. That's okay if it does happen. Just for those who might experience that and freak out, please don't. It's just air being released from any of the joints that feel like they want to be moved in a little bit of a different way, and then they release the gas that's in the joint, self-cavitation. And I think probably the most important thing to note is that this is definitely a step up than compared to the previous exercise. So if you are experiencing any pain or discomfort, this is not the exercise for you, particularly if it's located through the lower back. This exercise will utilize lumbar extension first before adding in the rotation. So just be really mindful if anyone experiences lower back pain. This may or may not be the exercise for you, depending on your own individual injuries and so forth. But you can certainly practice it in small amounts first and then build from there. I do also have a lovely variation of that exercise that we showed during our ballerina series that I will bring up. A nice little video of Michigan. And this variation is lovely because it adds in just that little bit more. So for those who are potentially those the elite dancers amongst us who are working on their capezio or extended capezio lines, and they're just wanting to get a lovely leg extension behind them, this is a lovely one to actually work on a hip flexor stretch component now as well. So there's so much that's being mobilized in this scorpion stretch.
Yeah. And I think that's the important part as well, is some exercises you may be given in the beginning are specifically targeted to the thoracic spine. But then as your rehab progresses or as you're working to certain goals, it should be starting to progress as well with that. So you should be then doing more combined movements as part of a mobility program as compared to isolated. Again, everyone's a little bit different, but that should be the pathway it's going down.
All right, so we've chatted for a while now, so I'm going to pretty much almost wrap it up here. Before we do that though, what are some key points or takeaways for students and instructors out there wanting to improve their thoracic mobility?
I would really challenge everyone to have a little bit of think about what you're doing for your warm-ups and your cool downs, and think about, are you actually doing some exercises that promote thoracic mobility? So we really emphasize with our warm-ups and our cool downs that you're moving the joints through range, initially nice and gently, you're getting the heart rate up. Think about, are you actually doing some exercises for the thoracic spine? And if you aren't, that's also a great opportunity to book in with the Pole Physio just to have a chat, because you may find that you're not 100% sure what some of the exercises that you're doing as part of your warm-up are targeting. We can actually help provide some information about, okay, this is what this exercise specifically is doing, and here are some variations depending on if you're in a beginner's class, depending on if you're doing a tricks class, depending on if you're in a more advanced class, depending if you're doing a splits class. There's many different variations that we're able to provide for that.
Yeah. And we now have, like you said before, we've got the 3 therapists, so myself, Jake and Danny, who are available to provide online services to pretty much between all us 3, everyone worldwide. So Jake's able to treat US-based polars, Danny and I can treat everywhere else in the world. So for those of you who are unsure about what physio would look like online, this is a little bit of a snippet. There's a lot of us understanding what your body actually needs, and assessing what your capacity is, and then actually working towards bridging the gap between what you need versus what you actually have. And so there's a bit of a misconception that physios only work with injuries, and look, there's going to certainly be a bunch of therapists out there who only work with injuries, and that's what they're used to. But I'd like to think that we're certainly as a profession moving out of that box and building more on our performance based aspects. So we're here to help you actually unlock your goals and get you where you want. So definitely from a thoracic mobility point of view, I work with many people that their main goals are to get their needle scale, and they're working on getting a bit more thoracic extension or rotation to get their arm to their foot, or they're wanting to unlock, their ballerina or so forth. So definitely, if that's you, if you're someone that's wanting to work on a goal and you're really lacking progress by your own training, then certainly touch base with one of us from the team, because we can get you there, and I can pretty much guarantee you'll be a fraction of the time that what you're compared to you training alone. That's for sure. Yeah. Well, thank you so much, Caitlin, for joining us today. I'm so glad that you're able to take the time out of your busy schedule to spend with us. So thank you so much for imparting all your knowledge and wisdom. I'm looking forward to having you back. I've got you for a part 2 coming up shortly, which will be on dizziness, which is an interesting topic, because not many people think about that from a pole dance perspective, but there's lots that goes wrong in the normal person and from a dizziness perspective when we pole dance. So I'm looking forward to having you there for part 2, but I'll not spoil too much of it now. I'll wait for everyone to watch that session.
It's going to be fabulous.
It is going to be fabulous. I'm excited. Thanks everyone who's joined us for today's episode of the Cafe Virtual Summer Series. Hold it properly. Cheers. Hope everyone's enjoyed this with their cup of tea, and we'll see you for the next one. Bye everyone.